The month of July is known for a lot of things. It's actually even National Hot Dog Month. But when we get serious about the things that are going on in July, we want to talk about mental health for a moment. Dr. Stephanie Jamison-Void joins us. She is a psychologist who is involved very much in the Office of Health and Human Services. This is Minority Health Awareness Month. Tell us a little bit about why and why we should be all concerned about it.
Well, yeah, we're honoring this month for, the importance of mental health awareness. Yeah. I think that is become apparent over the last 2 years recently that these disparities do exist in our minority communities. And so, we're glad to be a part of an organization that can represent those that are in underserved populations.
Minority mental health has, as you mentioned, become really much more to the fore, and yet you tell me that minorities are more apt to actually report having mental health issues. They're just apparently not getting served. Tell me more about that dichotomy.
Absolutely, they are. A lot of minorities understand that things are different, things are changing their lifestyle, something is not quite right. And so they're looking for providers that can help them. In a lot of those rural areas, it's just there are not a lot of providers that can assist them.
Okay.
And so they go underserved in that category.
So it is kind of like it is with everything else medical these days. The folks in rural areas are having issues getting served, although in rural areas maybe they're not so apt to report physical ailments, but they are mental?
Well, it's a combination of both, because the physical affects your mental.
Yeah.
So if there's a lack of the physical health, then that moves into your mental health. I mean, with obesity and diabetes, all those move into a form of mental health, a mental health state.
All right, what can we do about it?
We need to continue to be aware of it.
Right.
It's great that the knowledge is there, that families understand that there's a change. But when they go to their doctor, it is great to be able to work with offices that can refer for a specific mental health illness, because they're kind of one and the same. You go for physical, you need your mental health as well. And so we need to continue to network and refer within doctors' offices, primary cares, that we have providers out there that are able to assist.
Do most primary care physicians do that? Do they, in the back of their mind during an examination, think, how is this person doing mentally? Or is that something that we really need more awareness among doctors to do?
Yeah, they do. They are aware.
Okay.
A lot of them are trained as well as to identify those things, and they do make referrals. Down in the Low Country, we do receive a lot of referrals, even from our pediatric doctors.
Okay.
For children, we do get referrals for them that are experiencing. Local school districts make referrals. So the knowledge is there, the education is there, the information is there. We just need to make sure that more providers are available in these areas.
Okay, if people in the minority communities want to learn more and want to report issues without having to go through their doctor and doing all of that, where's a place for them to go? Where's a resource for them?
Well, one thing about Jamison Consultants is that we are in those areas.
Okay.
We're in a lot of the rural communities. But we also have the state agencies. They have state mental health agencies that they can go to. But a lot of them really do go to their primary care doctor.
Okay.
If not, they search the internet. I mean, there's so much of those resources on social media. They can use their phones to find. They can do questionnaires. They can do online assessments. So there's a ton of information out there for families to be able to have at their fingertips.
All right, we appreciate the time and getting us more aware that there is an issue that needs to be out there and discussed. Dr. Stephanie Jamison-Void, we appreciate your time again, and thank you very much for joining us.
Thank you so much for having me.
Thanks to all our guests for helping make us just a little bit smarter, and we thank you for tuning in to the WHHI Daily News. I'm Bob Stevens. If you missed anything at all, we'll be back in 90 minutes.